How about now?
Perfect.
That's great. Thank you.
All right, sounds good. Well, welcome and thank you for joining us today for this webinar on the My Healthy Vermont workshops. As a librarian, Larissa, you often serve as a really crucial resource for your library community and helping people get access to the information and support and tools that they need. And the My Healthy Vermont workshops are a wonderful and really accessible resource that could be really useful for your library community. So we really appreciate that you're here and that you're interested in learning more about them today. There will be 4 of us giving the presentation today, so we can start with introducing ourselves. My name is Neva Cody, and I'm a chronic disease prevention specialist with the Vermont Department of Health. And today I'll be sharing some information about chronic disease among Vermonters. So talking about the prevalence and the impact of chronic disease, as well as some evidence-based ways that the conditions we'll be discussing can be prevented and managed.
Great. So I'm Joanne LeMay. I prefer to be called Jo, but I'm here under the umbrella of My Healthy Vermont. I work at Rutland Regional. I'm a regional coordinator or a outreach specialist for the southern 4 most counties. And I'm excited to share these with you.
Hi, I'm Walter Ziski. I work for the community health team at Gifford Healthcare. But for today, in this presentation, I am also a lifestyle coach for the diabetes prevention program, the hypertension program, and the diabetes self-management program. I'm also a master trainer, Select, who trains other facilitators to host and lead the diabetes prevention program.
And I'm Melissa Southwick. I manage the My Healthy Vermont program. So this program is funded through an 1115 Medicaid waiver. Vermont's Blueprint for Health receives these funds and then partners with the Vermont Department of Health, where I'm based, to provide administrative oversight. This means that we're uniquely situated in Vermont to be able to offer these workshops free of charge to anyone who is 18 or over and either lives in Vermont or receives medical care here. Most other states need to either bill the individual or their insurance to participate in similar programs. We do not ask income or insurance information, which makes our programs uniquely and truly accessible to all. So I will walk you through in a little bit our website and how to make a referral. But in the meantime, I will pass it back to Jo to get us started.
Great. Thanks, Melissa. Hi, again, I'm Jo, and I'm here to tell you about My Healthy Vermont workshops, about them, what they include, what is to participate, although I think Walter will say more. I've been working here for 2 years, and as Melissa said, we offer free evidence-based self-management workshops, which basically mean that they empower people to manage their own health. And Vermonters who complete our workshops see big improvements in their health and their overall well-being. And as on the screen, we offer 6 workshops: the chronic disease, chronic pain, diabetes prevention, diabetes management, quit smoking, and high blood pressure. The workshops are facilitated experiences. They're not taught. It's the peer group of the participants that truly make the workshops succeed. And later in the presentation, Walter is going to be sharing with us some of the feedback from the participants.
So what we'll do next is kind of go through each condition and talk a little bit about, or each workshop, and I will talk a little bit about the condition, and then Jo will talk about the corresponding workshop. So the first workshop we'll be discussing is the one on chronic disease management. So I'll talk a little bit about chronic disease in Vermont, its prevalence, its impact, as well as some evidence-based ways that we know are useful in preventing and managing them. So to give you a sense of the prevalence among Vermont adults who have been diagnosed with the chronic conditions that have the highest rates of mortality, 9% of Vermont adults have had a heart disease diagnosis in their lifetime, 10% have had a non-skin cancer diagnosis, 8% have diabetes, and 15% have been diagnosed with a lung disease, either chronic obstructive pulmonary disease, asthma, or both. Living with an unmanaged chronic condition can also, it can reduce someone's quality of life in many different ways, not only reducing their quality of life in terms of physical health, but often also someone's social, emotional, and spiritual well-being as well. And it's important to mention too that there are significantly higher levels of chronic disease among certain subpopulations of Vermonters, including those who have lower education, less income, racial and ethnic minorities, sexual and gender minorities, as well as Vermonters who have had a substance abuse or mental health diagnosis. And ultimately, Vermonters are more likely to die from a chronic condition than from all other causes combined, and many of these deaths are largely preventable. What we do know, though, is that lifestyle changes, education, and support can really help people to better prevent and manage their chronic conditions. And access to education and support is especially important for many of our most vulnerable Vermonters who might be working with more limited resources.
All right, so our first workshop, chronic disease management, that I'll speak about. In this workshop, the facilitators give guidance and support to live, for the participants to live better with long-term, with the chronic health problems like arthritis, depression, asthma, diabetes, cancer. We know that long-term problems can lead to serious complications that can make it difficult to work. So we give some small steps that we can do, and I'll talk more about them in a minute. But this workshop is 6 weeks for 2.5 hours. Thank you. I'm sorry, I'm on the wrong slide. Do you want to talk, Neva? I have nothing else to say about the disease. I'm so sorry.
Okay, perfect. All right, so the next workshop we will talk about is on chronic pain. So nearly 21% of US adults experience chronic pain, and around 7% experience high impact chronic pain. And of those with high impact chronic pain, a vast majority of them are unable to work for a living, 83% of them. And for people with all levels of chronic pain, there are often mental health and social implications that they experience that often can further exacerbate their physical symptoms as well. But what we do know is that chronic pain can be improved through slowly building strength and mobility, and that social and emotional support, both from other people with chronic pain as well as from someone's friends and family, can be really impactful.
Great, thank you. So chronic pain causes our nervous system to become oversensitive. An oversensitive nervous system tells our brain to protect our body. One of the most difficult things to understand is that pain is not disease or injury. Pain is a response to the brain's assessment of danger. Pain is complex, and that makes sense because the human brain is so complex. So we can change our nervous system and teach it to be less sensitive. The chronic pain workshop is designed to give self-management tools to take on tasks and help participants become more active self-manager. So we use a virtual toolbox in a few of our classes, and we don't expect everyone to take the tools out, but we ask them to try it for at least a couple weeks. And we also talk about the chronic pain cycle that you see on your screen. And we talk about with our participants how they know from personal experience that each symptoms that they feel can affect every other symptom. They may have more pain when they are fatigued or don't sleep well. We know mood affects pain, pain affects mood, and being physically active and doing exercise most certainly helps manage pain. But for some people, finding the right amount of physical activity and exercise can be difficult. So a big talking point is pacing. So we talk about pacing our activities. Embedded into the program, we have Moving Easy program that we do with our participants, just some slow, gentle movements that we can all do. So these are 6 weeks and for 2.5 hours. Okay, slide.
All right. So next we'll be talking about the diabetes workshops. So My Healthy Vermont offers 2 diabetes workshops, one on diabetes prevention and one on diabetes management. So I'll talk a little bit about this condition among Vermonters, and then we'll hear about each workshop. So 8% of adults in Vermont have been diagnosed with diabetes in their lifetime. Um, and there are many more Vermonters than that. We don't know exactly how many who are living with diabetes, but who haven't necessarily had a diagnosis. And when diabetes isn't well controlled, blood sugar can increase, and that can cause high blood pressure, hardening of the arteries, and damage to many parts of the body, all of which can have some real negative implications for somebody's life. And many factors impact the development and progression of diabetes. But understanding more about your condition and making sustainable and informed health behavior changes are some of the best modifiable ways to prevent and improve this condition.
Thanks. So the Diabetes Prevention Workshop, which we call the DPP, it's a proven program to prevent or delay type 2 diabetes. It was developed by the CDC with the concept of small steps, big changes. And that is encouraged throughout the whole program. Each week, there are 26 weeks. It's an hour a week for a whole year, but just think everyone's worth like the 25 hours that this takes. So each week we talk about how to read a nutrition label will be 1 week. 1 week it'll be changing negative thoughts to positive thoughts. And slowly each week we just change our habits, hopefully slowly. So we ask anyone to take the pre-diabetes risk test that's attached here. Just to see if you're at risk and come join a group of people who are motivated to lower their A1C. And again, it's a year-long course, 16 hours of weekly core sessions and then monthly maintenance sessions. Okay, and then for the diabetes, so picture the toolbox, but the diabetes management workshops. So self-management tasks are facilitated to help take care of their health conditions, carry out normal activities, include healthful activities, manage food cues, and become an active partner in working with your healthcare team. We use a toolbox like this in the chronic pain workshop, and we ask people just to take out something, try it for 2 weeks, see how you like it. If it works, that's great. And if not, just put it back in your toolbox, but at least you've tried it and you know. So these are 6 weeks sessions at an hour and a half a week. Thank you.
All right, our next workshop we'll be discussing helps people quit using tobacco and other nicotine products. So in Vermont, 13% of adults report smoking cigarettes, 6% use e-cigarettes, and 3% use smokeless tobacco. And tobacco use is Vermont's leading cause of preventable deaths, and it contributes to 4 out of the 5 top causes of death in our state, those being chronic lower respiratory disease, cancer, heart disease, and Alzheimer's. And it's important to mention too that countless other lives are also impacted through the effects of secondhand and thirdhand smoke. What we know is that quitting tobacco can prevent the development of a disease and improve symptoms of a pre-existing disease. And support from others, like through a workshop, in combination with other strategies, can really greatly improve the chances of someone's being able to quit successfully. And this is especially important for people who might not otherwise have access to as many resources and social supports in their effort to quit.
All right, so our quit smoking workshop. So anyone using any form of nicotine is able to join. Smokeless, vaping, it's hard work. We understand that. Nicotine is highly addictive, as addictive as heroin or cocaine. And Mark Twain said, quitting smoking is easy. I've done it 1,000 times. Studies show that people who smoke must deal with both the physical and the psychological dependence to quit and stay quit. We help participants create an action plan, and an action plan we do in each workshop, by the way, for becoming tobacco free. Again, we give tools to participants to how to stay motivated, ways to manage their stress, cravings, We can also offer some nicotine replacement to assist people on their journey to becoming tobacco free. And as you see on the slide, one of the many tips and tricks we give are the 5 Ds: delay, discuss, drink water, distract, deep breathe. Quitting with the support of counseling and medicine can double or even triple chances of success. These workshops are 1 hour a week over 4 weeks. Thank you.
The last workshop we'll be talking about helps people manage high blood pressure, also called hypertension. So 32% of Vermont adults have been diagnosed with hypertension, and it's a risk factor for lots of serious conditions, including heart disease, stroke, and kidney disease. So this makes it really important for people who have hypertension to get prompt help in managing their condition. Hypertension can be effectively controlled through things like regular blood pressure monitoring, education about your condition, as well as sustainable changes in health behavior, nutritious eating, regular exercise, tobacco cessation, and adequate sleep.
I lost my mouse. So the high blood pressure self-management workshops. So these sessions for the workshop have been developed for people who have hypertension and have an interest in managing it, so they won't develop the other serious health problems. We start with learning the basics of high blood pressure. Not everyone knows why they're taking a pill, so I always appreciate a good learning moment myself. We learn how to read the food label. We see that a portion and a serving sizes are not really the same. It's a wonderful class, and again, it's the peer group that help this. And this is 8 weeks for 1.5 hours. Thanks.
I'm going to talk about the health benefits of taking these workshops. The first one is empowerment. Many people come to these workshops not knowing even how to start. As Joe mentioned, that in all of the workshops, we create action plans, and trying to know what action to take first can be a struggle for many people. And all the workshops, through the peer group, through examples, they're able to figure out what action they want to take and how to make those steps successful. The participants learn from peer leaders who have been trained to lead these evidence-based workshops. They've been trained, like I said before, I'm a master trainer for the diabetes prevention program. It's an evidence-based program that have been clinically tested. All of these workshops have done that. And the leaders are peers. They're not experts in their field. So that they can interact with the one-on-one, with the group and things like that. So, they're not coming in as an expert saying, you need to do this or you need to do that. It's together, the participants are able to figure out what works best for them. They learn from the other participants. They realize they're not alone in this health struggles, and they're able to share their experiences, their successes, as well as some of the failures that they've had with their chronic disease, and they're able to brainstorm on how to make steps forward. They're also aware to become aware of food labels, activity supports, what supports they can have to be able to safely and effectively manage their chronic condition, not just, and also engaging with their healthcare team is also a better engagement, because they're able to learn things that maybe the 20-minute visit, or if you're lucky, a 40-minute visit you have with your primary care provider. If you're in an hour session or an hour and a half session or 2.5 hours, that's a lot more time they're able to understand and grab some knowledge that you can then take back to your healthcare team and say, I learned about this and this has been working for me. And then your provider can say, that's great. Let's build on that too. Learn skills to improve health outcomes. Many people, as I said, come into these groups and not knowing where to even start. So learning the small skills, the behavioral changes to self-manage their condition is greatly important. And also to see a path forward. Okay, here I am now, but what's my healthy path forward versus, okay, my doctor has said I have high blood pressure, and these are the negative outcomes of it. What are the positive outcomes if I make changes? So those are all things that are great. And I also want to put a plug in for facilitators. We're always looking for new facilitators to be able to lead these workshops. It's a passion that people have to be able to come and lead these workshops and be able to engage in people. And it's fantastic how we can see the positive change with many people. I had one participant in the high blood pressure workshop who came in and his blood pressure was in the 170s for the high number. And just by reading food labels, he was able to reduce his blood pressure into the 140s. And he realized that can of Dinty Moore that he was eating for breakfast, that hash was 4 servings, not 1 serving. And he was eating 4 servings of that for breakfast. He realized, oh, wait a minute, that's and all the sodium that was in it. And then he went from there to looking at his cereal, and he chose the one that had no added sodium to it. So just little things like that can make a difference.
Thanks, Walter. Well, I'm sharing my screen. I think, Neva, actually, I'm going to share so I can show around on the website. But while I'm doing that, I'll share one of my favorite stories of one of my participants in my diabetes prevention program. He came in and said, I eat ice cream every night after dinner, which is a choice and that's fine. And we're not saying that any food is a never food, but throughout the program, he decided what he wanted to do was cut down on his ice cream, and he rewarded himself once a month on the day of his birth with his ice cream. He also really increased his exercise. He didn't lose a ton of weight. I think he lost like 2 or 3 pounds over the course of the year. But when he went back to his doctor at the end of the workshop, his A1C had gone from the very highest end of the pre-diabetes range into the normal range. And his doctor was astounded and said, how did you do it? And he said, well, it's that workshop that you told me about. I made some of these small changes and I kept with it over the whole year, and this is the result. So they were both very pleased because regardless of the weight loss, his health had definitely improved while he was in this workshop. So I am going to show you, now that you have heard about the workshops, I'm going to show you the website because there's a wealth of information on the website. And can you all see it? Can somebody just let me know if you can see okay, perfect. So this is the homepage. When you go to myhealthyvermont.org, this is the page that you're going to come to. And there's a lot that I want to walk you through on here, but we'll just start with this homepage. So you will be able to scroll down and see the workshops that Joe just talked us through. And what you can do when you're here is you can click on one of the workshops that maybe you're interested in, and you can scroll down and see what workshops are coming up. The other way that you can see, and I'll show you real quick here, is if you just go to this workshops button on the top, you can scroll down and see all the upcoming workshops. So maybe there's a couple that you're interested in, you're not sure which one you want to do, or you're not sure which one will work with your schedule. You can scroll down and see everything that we have scheduled right now. What I will say too is that we are constantly adding more. So if you don't see something that you want right now, check back. The other thing that you can do is you can just reach out, even if the workshop you want isn't scheduled right now, and I'll show you how to do that. So if you're helping someone, they want to join, let's say, this upcoming quit smoking workshop, they can come click on the Get Started button. And all they have to do is give us some very basic information. So they give us their name, first and last name, email address, their zip code, and their phone number. We are able to work with people in neighboring states if they're receiving any kind of medical care here. So if they come over for primary care, if they have a specialist, if they get their dental care here, it does not matter. As long as someone is receiving some kind of medical care in the state, our funding allows us to serve them. So if they don't have a Vermont zip code, they can just put 0000, and that will let us know that we can reach out to them and figure out if they're eligible or not. They let us know which workshop they're interested in, and then they hit send. This comes to an enrollment specialist. Her name is Caitlin Maroney. She's a health coach. She's fantastic. And she calls everyone. So every inquiry that we get receives a phone call and an email. We make sure that we contact them and connect with them about getting them registered. The other way that you can help somebody, let's say you're talking to someone and they really want to do this, but they are not interested in coming in and filling out this form, you can help them with that. If you go to the providers page up here, you have to scroll down a little bit. We're trying to get that moved up, but you scroll down, you click refer a patient. You do not have to be a medical provider to do this. Anybody can do this. So it's just making a referral for someone that's not yourself. Please make sure they know you're doing it, but then go ahead and fill it out. You can put their first name, last name, email, and phone number, and then tell us who you are so we know who's using the form. And then you would just hit send. We receive that in the same way, and we call those people in the same way that we do the other way that I showed you. So there's two different ways that people can get referred to programs. Some other things that I want to show you on the website, there's a prediabetes risk quiz. So I will walk you through that. It takes literally less than a minute. So I just want to show you because as somebody, I'm not sure if it was either Neva or Joe mentioned, 93% of people at risk for prediabetes do not know that they are at risk for prediabetes. So it's very important to just help people understand their risk. So you do start quiz, and we're going to make up a fictional person. It's 50 to 59-year-old male, and he does not have gestational diabetes because he was not pregnant, but he does have a mother and a father with diabetes. He does not have high blood pressure, and he's not generally very physically active. So he is 5 foot, let's say 10 inches, and he weighs 220 pounds. So he scored at a 7, which any score between 5 to 10 means that you're at an increased risk for having prediabetes. It does not necessarily mean that you have prediabetes. It just means that you are at risk for developing prediabetes. In order to be eligible for the prediabetes workshop, you have to score at least a 5 or higher, or have a diagnosis of prediabetes, or have an elevated A1C. So any one of those things will make you eligible for the program. The other thing is we don't turn people away. So even if you have none of those, but you have a family history of diabetes and you're worried about it, come talk to us. I'm sure that we can find a workshop that will work for you. And then the last thing I wanted to show you, well, there's actually 2 more things I wanted to show you. Under other resources, we have a whole list of resources that come up during our workshops. So a lot of times in our workshops, we're talking about healthy food choices, and that can be pretty expensive. So we've put together some resources here that way everybody that goes to the workshop, if they have questions, they can come to this website and they can learn about resources that are available throughout the state. And then partner resources are for you. So if you want to put up rec cards in your library or you want to hang a poster, you can either download the poster or you can email me and I can send you some that are printed. So this is a place to go and find resources that you can use. The prediabetes risk score is here too if you just wanted to have some printed out to have on site. And then the last thing that I wanted to show you was the videos. So I'm going to actually play the short version of the video, but I encourage you to check out all of the videos. There's a longer version, a shorter version, and up above I scrolled past a provider version talking about the workshops. So these are just, I'm going to share this one so you can get a sense of what it's like. And let me know if you have sound or not. I think I clicked share with sound. Can you hear it?
People, I think, have a hard time with change.
Inhale all the way up.
That's normal. Strive for growth.
All I wanted to do was hide behind my extra large clothing.
I think you end up in your head a lot, ruminating because you want to move forward and you want to change, but you don't know how.
What I learned from this program, with prediabetes, you have the opportunity to get rid of that diagnosis. Once you get diabetes, once you cross that line, there's no going back. It has to be the exercise and the food and the sleep and reducing stress. MyHealthyVT is what kind of tied it all in together. It's like once or twice a week.
That's nothing. The space was actually online.
And it's free. You have nothing to lose except maybe a few pounds and your prediabetes diagnosis.
You will grow during this workshop, and I think that's what life is all about.
Cheers.
All the power is in your hands. It takes some of us a little longer. I guess it took me a little longer.
I want to be the best mom, the best aunt, the best family member that I can be. It starts with how I take care of me now.
It worked so well for me. I've been wanting to get to this healthy point in my life for so long.
I'm no longer pre-diabetic. So, I mean, That's like longevity. That's like quality of life.
When you're 30 years old and you start this work, you know, it means that when you're 60 or 70, you can be doing the things that you can do now.
Just give it a try. Get to living. Get goosebumps.
Okay, so I picked the long version. I thought I picked the short version. The other one is the same thing condensed down into 30 seconds. But I have to say, all three of those people are actual participants. One is a leader as well, a facilitator, and they are all in the Northeast Kingdom. So those are real Vermonters telling us about their experience. And it is just incredibly powerful. I got to meet Loretta, who's one of the women, and talk with her about it. And it was just very moving. This is a video of Dr. Kunis up in the Northeast Kingdom as well, talking about her experience referring people to the program. So I highly encourage you to check those out, to share them. It really, I think, gives a sense of what, you know, what can be accomplished and what can be experienced through the workshops. So I believe that is all that I wanted to share on the website. So I will stop my share. And I think that we allowed time for questions. I don't know, Larissa, you're kind of on the spot because you're the only one here, but do you have any questions that you wanted to ask?
Can you guys hear me okay?
We can.
Okay. I don't necessarily have a question, but I just wanted to comment that the work that you're doing is so impactful. And yeah, I'm so grateful for your presentation today. I really got a lot of information out of it. And yeah, thank you so much. It's really important work that you're doing.
Thank you. And one thing I did forget to say is that most of our workshops are offered online, but we can offer them in person as well. So if there are any librarians out there who are looking for a workshop to have on your premises, you can reach out and let us know that too. On the website, there is a place when you go to the contact us section, you can say I'm interested in hosting a workshop. And so we could actually, assuming that we have a facilitator in your area, and we have about 70 facilitators across the state, we can coordinate having an in-person workshop at your library if that's something that you're interested in doing.
Wow, that's amazing.
So I think that's all for me. I don't know, Neva, if there's anything else that we want to do to wrap up, but
No, I think that's it. But thank you for taking the time to learn about this. And I think it could be really impactful for plenty of people who you might kind of come in contact with at a library. I know you said you're a future librarian, which is awesome. But yeah, I just wanted to say thank you so much for learning about this. We all really appreciate it.
Thank you.